So today I want to talk a bit more about conflict of interest. I referred to it yesterday morning. Other people have spoken about it. Certainly some of the pressures that John Armstrong and others identified in the previous session speak to areas of conflict of interest. And I think it's important to recognize this is an issue and to recognize the specific conflicts of interest in the programs that we're concerned about, in the citizen advocacy programs. We are not always able to eliminate conflicts of interest, but it's important to at least recognize them and name them. I just start with a reminder of the land and country acknowledgement and why it's important for all of us, those of us who live in unceded lands, as well as those of us who live in lands that are governed by treaties. Okay, I'm not going to spend as much time on definitions as I did yesterday, but of course, as a teacher, when you put this together, you put in these slides because you can't help yourself. So, and it's my knowledge that all of these slides will be made available to conference attendees. So if you want to take down notes, you can. You won't be graded on them, but they should be available to you later on. What I want to highlight in this definition of citizen advocacy is the reference to interests and conflict of interests. And so that we always ask the advocate to take on the interest of another person as if they were the advocate's own, and that in order to do this, advocates need to be free from conflict of interest, particularly around the protege and what, who might be involved with the protege and services they receive and so on. So I'm going to talk a little bit about the terms. We talk about advocate and citizen advocate. And an advocate is the person who defends, recommends, who supports, and so on, the cause of another. And in the case of a citizen advocate, the cause of the protege. And the word protege, if you go to the dictionary, has two common meanings. The first, because this is a French word, comes from French, and it is to be protected, protéger. Je fais un protégé, I protect someone. And the second meaning, which has been used in English for hundreds of years, is that of a mentor or a teacher of a particular individual. So we think of protégé from the arts. He was the protégé of. And the implication there is that the student or the individual who's the protégé of a master, if you will, is that this person has been seen as someone who is likely to achieve greatness in that particular field, and they're being mentored in a particular way. So those are the two common usages of the word protégé. I'm not going to talk about the principal or key office activities, except to say in this presentation I'm going to focus on the principles of advocate independence and program independence as protection, if you will, against certain number of conflicts of interest. And so I have the definitions just to remind us what they are. And so advocate independence, we protect the role of citizen advocate from influence from the Citizen Advocacy Office, from human services, from family members, or any other potential source of influence. And we talk about this directly with advocates when we recruit them and through follow along and support. And primary loyalty to protege is a part of that principle, but it's not only do we try to insulate advocates from conflicts, we also try to promote their loyalty to the person, to the protege. So that positive identification, because one, that's important for the protege, but also it's another safeguard around people or factors that might unduly influence the citizen advocate. We want them to be influenced, if you will, by the protege and his or her situation. And then ditto for the office. We want to make sure that the program is protected from undue influence and demands. And just as the previous session we talked about those external pressures, we never get rid of them, but it's important to be clear and conscious about them and about what the cost is. We thought we were entering this funding agreement or whatever, and we thought these were the costs, and now we know these are the costs. Are we going to do this again? What are the implications for us? I will spend a couple minutes here talking about interests because we sling the word around a lot, just in general, and it has different meanings in different contexts. So the dictionary definition, if you will, is interests are things that I'm interested in, hobbies, activities, and so on. Those represent my interests. But we also talk about interests at a deeper and more enduring level, things that are beneficial or helpful to me, you know. It's in my interest to get a good education because it opens up opportunities for me. It's in my interest to maintain a level of physical health because it allows me to do certain things and not others. It's in my interest, you know. So that's interest. And we also think about the interests of organizations. And in this case, that can include a citizen advocacy office. What is in the interests of this organization? One of the things when we teach SRV and social devaluation is always to look past what people say, whether they say it talking or in writing, about the purpose of their organization, but also in what they do and how they do it, because that's where you see evidence of their interests. So earlier, John Armstrong talked about goal displacement of organizations. I'll mention that here as well. Sometimes organizations they don't lose the plot, really. They often make a conscious decision. If we want to continue, we need money. They're not going to pay us to do this, but they'll pay us to do that. So we're going to take that money to do that in order to do this. And now you're facing a conflict of interest situation, but it speaks to the interests that are afoot. If we want to continue, that's an interest of almost every organization I know. They want to continue and carry on. And to do that, certain resources are needed. And so now the thinking changes a little bit. This is why we keep talking about consciousness raising and why it's so important to be very clear about this. And so what is needed to accomplish the work or the purpose of the organization, and what is needed to maintain the organization as well. And so, not too surprisingly, one of the things I suggest is it's important to be clear about this because otherwise we lose the plot. And we find ourselves doing something we never really thought we would do, or still don't think we should be doing, but we're doing it because ... I want to talk a bit about best interests because in particular, this is a concept that I think is rampant in human services, not just for people with disabilities, but in the child welfare system, in the health system, in the mental health system, and so on. And I just want to point out that best interests are almost always defined by someone other than yourself. Your parents determined what they thought was in your best interests and how they raised you. And I think some of this is, well meant, right? But parents do that. That's one of the roles of parents. And parents may feel obligated to talk to their children about how their children are raising their grandchildren. Isn't it in the best interests of the family? Isn't it in the best interests of this young child? The same dynamic happens in services. We think it's in your best interest to do such and such. Many years ago, as a researcher, I get to interview people about all kinds of things. And many years ago, I was interviewing 4 adults who lived in a group home in rural Manitoba, a community where you either drove for 10 hours to get there or you flew in. And the organization, this little organization, received money from a community member who died. And her charge was to buy something for the people in the group home to make their lives better. And the people in the group home discussed it and thought that what they really could use was a larger color television. And what the board decided was that they were going to buy them all cross-country skis. Because wouldn't that be good to get them out cross-country skiing in northern Manitoba, where the weather is, you don't want to think about it. But the people living in the home were dismayed. and said, we walk, but we sometimes snowshoe, but we prefer snowmobiling and we don't really want to cross-country ski. And anyway, this caused quite a bit of contention until the board was asked how many of them actually cross-country skied. Sometimes it's one, right? Sometimes it's one person who has discovered, I'm going to say discovered God by cross-country skiing, but you know what I mean. This is a passion of theirs. They are absolutely committed to it. And by gum, everyone else would be a lot happier if they also cross-country skied. And so there's, anyway, they decided to get the television. But they had to, they did a deal about, okay, if you get a TV, then you're going to spend so many hours a week walking. Okay, they all decided to live with that. But anyway, that's the concept of best interests. And we often forget the point about best interest means someone else makes that determination for you. So I think that's crucial when we think about interests. And with that comes this related concept that, of course, our notion of best interests really are in your best interest. Why would it be otherwise? I'm the public trustee. Why would it be otherwise? I'm your mother. Why would it be otherwise? On and on and on. And so we have a lot that's written about best interests, but that rarely takes into consideration what the person may be interested in, and at least acknowledging that. And we have this at the same dynamic at a program level. That is, board members have the responsibility to think what would be in the best interest of this citizen advocacy program in order for it to survive and thrive long into the future so that we can continue to do our work. That's the responsibility of the board. They should be thinking about that. But it's also important just to remember this may not always be a fully benign idea, and so a fully helpful idea. So just to be very clear about our thinking and why, because I think this notion of best interest can become a cudgel where we beat people up. And having done research in this area, at least in the province of Manitoba, around supported and substitute decision-making and the role of the public trustee. That report was from a few years ago now and has been made public, so I can talk about this. It was pretty clear from every single person we talked to, person with a disability, family member, staff, social workers, government workers, and the public trustee herself at the time, was that the role of the public trustee was to maintain the financial trusts left in her care and to pass them on to the heirs, and to have as little spending as possible made on behalf of the person for whom the trust was established. And our recommendation on this point was, you should tell families to avoid the public trustee at all costs. Which you can imagine that went down really well. So anyway, but she was adamant. I'm the public trustee. I only think about best interests. Whose interests is she representing? Okay, so I tried to identify common conflicts of interest and loosely organize them by principle. When the interests of two parties, that could be individuals or it could be organizations, when the interest of two parties that are at odds or interfere with each other, that's what the definition of conflict of interest is. People have differing interests, and you get a conflict now between those interests. I'll share with you the reference I relied on heavily for this presentation by Wolf, and he pointed out that some conflicts of interest are inherent. We're never going to get rid of them. It's the way the world works. And some are not inherent, even though we might think they're impossible to deal with. So while both staff and service recipients have interests, and both deserve to have their interests respected and enhanced, these will be at times in conflict, and it's an inherent conflict. So for instance, staff deserve good working conditions. I absolutely believe that. Reliable employment, predictable times of work, all that kind of stuff. The ability to have good time off, to be respected at the workplace, and so on. People who receive services will need services not during business hours, sometimes during a crisis. Sometimes when a lot of things aren't going well, because we're supporting people in their lives. And so when things don't go well, it's, yes, maybe they should be better behaved, but they're not, And so there's an inherent conflict there. And those of you who have worked in services and so on, it's always this at families who have self-directed supports. You know how hard it is to balance those competing interests and how you try to honor both parties and respect both parties. But there's always going to be this tension. And I think it's helpful to acknowledge that. And just to be clear with everybody and say, I hear you, and how can we work together? Right, so this isn't about how to do all of that, but it's just pointing to this as one source of a conflict of interest. It's inherent in our system and the way we do things. Okay, the interests of a family may be different than the interests of an individual within that family. This is really hard for some families. I'm the parent, I'm the brother, I'm the sister. Of course, the interests of the disabled family member are paramount in my mind, and I know what they are, And I've also had the opportunity to listen to adults who live with intellectual disability to know that they talk about having different interests at times from their family members. It's a conflict of interest. And then who do you support? I think many agencies struggle with this and try to balance it out and try to do so respectfully. And then they find they get blamed by one or both of the other parties because of it. But in citizen advocacy, we respond by saying advocate independence from all other influencers except for the person they're matched with. Because we're very clear about that. And sometimes that means standing with an individual and supporting them on matters where the family may not be in agreement. And and I understand how hard that is. I do, just from from situations in my own, friendships and so on with parents and other people. It's a tension that's there. And of course, this is true whether there's disability present or not in the family. So those of you who are aunts or uncles or older cousins, in Manitoba we call them cousin aunties, because there's so many cousins, but you're 25 years older than a cousin. So you're a cousin, but you're really more like an auntie or an uncle. Cousin auntie, cousin uncle. In the Mennonite tradition, godparent. You see a role within the family as looking out for this one person. And sometimes that's talking to their parents or older siblings and saying, maybe you should consider this. In that study we did when we looked at supported and substitute decision-making, a few adults with disabilities talked about how a sibling made all the difference for them. I know my parents love me and they want the best for me, but sometimes they just think I'm still a little stupid girl, said one woman. And most of the time I just sigh and get on with it. But every now and then there's something I really want to do and they really put their foot down. And so I call up my brother for advice. What does your brother do? He listens and then he walks me through things. If you do this, if you say this to our parents, then I think this might happen. Are you prepared for that? If you want to say this, have this conversation with our parents, I will come sit next to you. I'll support you. And in one case, the sister and the brother were both there in the room, and the sister, who I knew for many years, just said, my brother's invaluable to me. He's like my own personal jewel, she said, because I trust him and I know he listens to what I want to do. And then he says, mom is going to react this way and dad is going to say that. And then they talk through it. So sometimes interests of The family are not the same as the interests of the individual. Professional codes of conduct. So most professional codes of conduct for educators, for nurses, physicians, and so on, state the ideal of the profession. And I think it's important that they do that. This is what we're called to do in this profession. And we hearken to a noble ideal of service. And then we are people, and we're not always noble, and we never hit the ideal. And sometimes we do things that are really stupid ass. And sometimes we do things that I think are wicked. So there's a difference in intentionality there. And we know at one level that our behavior or our thoughts do not match the ideal that is stated in the code of conduct or whatever, wherever else it's stated. And there's a tension there for us. Yes, I know this is what we're supposed to say, but in my experience, this is what I've seen. That's a conflict of interest. It's a conflict of interest within an individual. And if you study SRV and you think about the first theme on unconsciousness and the importance of consciousness raising, this is where people might repress certain beliefs that they hold because it doesn't fit that ideal. And as Wolfensberger has suggested, it can't help but come out, often in disguised ways that we may or may not recognize because we can't live with it. You know, it's sort of tearing us up to a certain extent inside of us. It's important to recognize this and to be aware of this dynamic. And you know, it's very hard for us to recognize this in ourselves, which is why we need compadres. We need more than colleagues. We need people we trust who will be able to sit us down and say, Zana, what are you thinking? You know, let's talk about this. Not easy, but necessary. Whenever staff have to support more than one person at a time, there's an inherent conflict of interest there because there's more than one person at a time to support. And of course, we know this happens all the time. We know why it happens all the time. And sometimes I would argue it's more helpful to have a person support two people at a time rather than one at a time. There's some, pedagogical reasons for that. But nevertheless, we now have an inherent conflict of interest. It may be very difficult to fully respond to two or more people at the same time. That's a conflict. So we just need to be aware of that. And then in particular, when a citizen advocacy has connections to the human service system, there will be, that person has more than one master. That person will be unable to take full direction in the relationship from the person to whom they are matched. And this connection to the human service world, I would encourage you to think of this broadly. It's not only them and their past history or their current employment, but also the current history, connections, affiliation, and so on from people they're close to. So what if my spouse is at risk? If I do this and take this representation on, does this put my spouse into an uncomfortable position? And now, as an advocate, I'm concerned not only with the protege and what I'm thinking of doing there, but also with my spouse. And all of this may happen unconsciously, as we're taught in social devaluation. And so this is one of the reasons why there's such an emphasis on having advocates, coordinators, and most board members, all board members, have very limited to no connection at all to the human service system. Because the human service system wins every single time. So, and I also know, that's why I talked about the history of citizen advocacy a bit yesterday in terms of that context, where Wolf thought, well, this will be associated with parent groups. It's important to remember where that comes from, because some of the language from that early writing suggests that this citizen advocacy will be affiliated with certain types of services. And we know now, 50 years on, that that's hugely problematic. Okay, sources of conflict of interest in terms of program independence. So when the interests of a citizen advocacy program is at odds with the interests of other organizations, funders, and so on, here are some of the things that might happen. The funder wants support for certain things that aren't citizen advocacy, like direct services, other advocacy forms instead of citizen advocacy, or other worthy activities. And I know everyone here in Australia has faced this reality. And some programs went on to do other things and not citizen advocacy. So I just, more so I think than in North America, this has been an issue here. Okay, we're going to tender, but the tender won't just be for citizen advocacy. The tender will be for citizen advocacy and ... And that's when the board, who has the responsibility not only for promoting and supporting citizen advocacy, but making sure the organization can continue, now the board has a real dilemma. In order to maintain the organization, what else do we have to do that isn't citizen advocacy? And what will that mean for us? Board members who want to support something other than citizen advocacy. And I think almost all the time this is benign. That is, they see the situation that people are in. They want to be able to do more, whatever. So they say, let's run a recreation program. Let's, at our annual picnic, in North America this is common in summer, you have a picnic. It's a barbecue, and people come and you cook hamburgers and hot dogs and you throw a Frisbee around and all that kind of stuff. And well, why don't we turn that into, we expand it, invite people who live in group homes to come. We'll get some donated hot dogs and we'll feed them hot dogs, and maybe we'll have some activities for them to do and it'll be a nice day. And now it's not citizen advocacy anymore. Now it's a recreation program. Well-meaning people, and I have real examples of this, I'm not making that example up. Very well-meaning people who are really distressed at the situation of people with disabilities and other groups who are devalued, and this would not be the most helpful way of responding. It's a conflict of interest. Sometimes it's a coordinator that wants to do something that isn't citizen advocacy, and the board has to be on them. And I think one of the challenges in citizen advocacy is sometimes the coordinator's been around for a while and the board may be newer, and sometimes it's the opposite. And it can be really hard to take a newer board with a more experienced coordinator and say, wait a minute, John, what are you thinking there? But the board still has to do it. How does this relate to citizen advocacy? Well, no, wait a minute, no, it isn't, and call them on it. And then finally, the citizen advocacy program, what is it rooted in? How is it known in the community? And this all speaks to program independence. So if it's known as not connected with the principles of citizen advocacy, maybe more connected with certain human services or individuals involved in human services, and so on, that's a problem. And so you look at how the office communicates everything about its work and what it does in the logo, in the name of the program, in the location of the program office, in who's on the board, in what meetings does the coordinator go to. So in a lot of smaller towns, there are voluntary groups of service providers who get together to provide support and information to each other. And from a service providing perspective, I understand that that can be really helpful. And citizen advocacy coordinators have no business going to those meetings. Absolutely. They may, as part of their protege recruitment, want to have a few people they go for coffee with on an individual basis in order to find certain proteges in certain situations. But they don't want to be going to those meetings. So that's how are you known, how is the program known in the community? That can be hard, especially if you think you have a coherent perspective on things and you go to the meeting and say, if they only listen to me, I could clean their act up for them, and you have to put that aside. Okay, addressing conflicts of interest, and this is just some ways to think about all of this. Avoid them in the first place. Don't go there. So years ago, I can remember Tom Doody and I had breakfast with a couple of people at a citizen advocacy event. They were interested in starting a program, and they said, what advice can you give us? And we said, learn about it from other people, take SRV training, do this, do that, talk to these people. And then I said, no name, no logo. And they looked at me, and then Tom Duty said, yeah, right, no name, no logo. And they said, what do you mean? Don't spend any time at all on a name for the program. If you're in Winnipeg, it's Winnipeg Citizen Advocacy. Stop there. Don't go any further. Well, we were thinking, and 90% of the time, people have a logo and a name for their program before they have anything else. And I guess it gives you something to hang on to. Don't go there. Well, and as soon as you have to start explaining what the name means, you've lost the battle. So it's what will other people think of as soon as they hear and see that name and logo. So that's one advice. Just don't do it. Yeah, recognize what's at issue. This is that consciousness-raising process. Sometimes you have to invite someone else into that, a critical friend, someone who understands citizen advocacy, understands some of these conflicts of interest, but who is not directly affiliated with your program, to lead a discussion and to help you think about this in a structured way. I think it's important to distinguish between, is this an inherent conflict of interest, or is this one that isn't inherent? Because addressing those issues might be different. And of course, we often think of conflicts as inherent and intractable. And that's why I think having a critical friend can be really, really helpful. Or when you have a CAPE, say, we could really use help with this point. We don't know what to do about this. So if you had any thoughts about it, doesn't mean you're going to agree with the CAPE team, when they give you their thoughts, but sometimes that can be really helpful for the CAPE team because you're thinking already about, what are we going to learn and how do we communicate to people? And if there's an ongoing discussion and they've been thinking about this, that's good to know. Yeah, okay, so those are just some thoughts about addressing conflict of interest and that this is a process. This isn't something that you do and automatically it's gone. It's a process, and it's a process of awareness. And it's important to keep some notes about this so that when you recruit new coordinators and or board members, you can communicate some of this discussion and your thinking to them. Because otherwise they will come on and discover the wheel for themselves. And they may roll you right out of citizen advocacy. So, and I just want to show you, I know it's really big here, but just show you the reference that I relied on. Wolf's discussion about conflict of interest in human services, and he also referenced citizen advocacy, is really helpful. And this book is no longer in print, but it is available as a free download from the University Medical Center of University of Nebraska Medical Center. So as part of the Wolfensberger archives, most, if not all, of Wolf's writings are being digitized, and so you can access them for free. So Jack said CAPE manual isn't in print. There's probably never more than, maybe 350. People copy them. It's available digitally. You can download it. So you can find this stuff without having to pay a lot of money on Amazon for the last copy. Heather Hindle does have a copy of this. I've seen it. But she doesn't want to lose it either. Okay, so there are also conflicts of interest in human services that might be relevant to advocates, but I decided not to go there today. Thank you very much.